So a dental implant is something artificial that's placed in the area where a tooth was extracted. So there's all different types of implants, but basically it's replacing a tooth that was removed from the body. Well, I think the most exciting thing is that we're now using, or at least available, something called zirconia. It's a ceramic material. It's more biocompatible to the body versus titanium. The other exciting thing is that we can now place implants the same day as we do the extraction, so the whole process is much faster. Well, it's important anytime you lose a tooth to replace that tooth first and foremost, to prevent teeth from shifting, to improve function as you chew, because when you lose a tooth you lose some of that function. Also, it puts stress on the other teeth if you don't replace that tooth. And the main reason why you'd want to do an implant versus the other options, which are either a removable partial denture or a fixed bridge, is that one, it preserves the bone, two, it doesn't affect the teeth adjacent to it, three, it doesn't get cavities, so it's not going to need to be replaced, and rarely does it ever develop any gum inflammation around it. So the reason why you'd want to do an implant versus a partial denture or bridge is, first, a partial denture is something that has to be taken in and out. It does not preserve the bone, and at some point in time will need to be replaced throughout your lifetime, maybe several times. So from a cost perspective, it's going to end up costing more. Two, a bridge is something that's cemented in but requires the treatment of the teeth adjacent to it. So in some cases you may actually have to drill down perfectly good teeth. The bridge can get decay, it can develop gum inflammation around it. So with an implant, you're not affecting the adjacent teeth, it doesn't come out, it restores function better than an actual natural tooth, as I said, and it doesn't have to be replaced over a period of time. There's no decay, no inflammation. Yes, actually stronger. If you have any experience, of course, whoever I'm speaking to doesn't have that experience, but as a dentist, if you've ever taken a tooth out versus trying to take an implant out, it's sort of like taking a post that's been placed in the ground with just dirt versus one that's been placed in the ground with concrete. They are very stable, they integrate with the bone itself. The main anatomical difference is that with a tooth there's a ligament that attaches the tooth to the bone. That ligament is soft tissue. So when you're removing a tooth, you just have to create enough movement to cause some expansion of the ligament to allow the tooth to pop out. With a implant, because there's threads, the threads actually integrate into the bone. So in essence, it's actually going to give you more strength and stronger than your natural tooth. Well, it could vary from 3 visits to as many as 10, depending on where you got involved. If you came in to have the tooth extracted and there was sufficient bone, there wasn't a lot of infection, you could probably place the implant that day. Wait for that to heal. You could even put a temporary crown on there, so that you might have as few as 3 or 4 appointments. If there was significant bone loss, we had to do some bone grafting, we had to wait for that to heal, and then come back and do the implant. It could be as many as 10 appointments. So it really depends on the individual. That can also vary. If for the same reasons of how many appointments, it's going to vary based on what the status of the patient is. If they're coming in, they're having a tooth extracted, we can many times place the implant the same day. If there's too much bone loss or there's insufficient bone, we can't do that. Or if they had the tooth extracted 5 or 10 years ago and there's been a lot of bone resorption, we have to build the bone back up, let that heal, and then come back and do the implant. So that's a good question. Well, we use local anesthetic like any other dental procedure. For anxiety, we have a program here at the Julian Center for patients that are anxious. So after the implant is placed, you'll have some soreness, some tenderness, a lot less discomfort than, say, having a tooth extracted. Well, the biggest advantage is that you're staying with the dentist that you've built a relationship with and you trust, rather than being referred out to someone you've never met before. 2 is that the general dentist is always going to restore the implant that was placed by the surgeon. So the typical scenario is that patient has a problem, they go to the surgeon, have the tooth extracted, they wait for it to heal, they go back to the surgeon, maybe to place the implant, and then once the implant heals, they go back to the general dentist. Or if the general dentist does extractions, they might send the patient out for the implant and then come back and do the crown or the restoration. That's never done by the oral surgeon. So the surgeon, as good as they might be, they don't really understand how important placement is as much as the general dentist. The general dentist sort of has to make up if the implant's not placed properly positioned and parallel to the other teeth. They then have to make a restoration or crown to fit in a ill-placed or poorly placed implant. So the general dentist is less likely to do that because they're the ones that have to restore it. That's a difficult question because every insurance is different. I can tell you this, there are some insurance companies that will pay for the reimbursement. More than likely, if you have dental insurance, if they don't pay for the implant, they more likely will at least pay for the crown that goes over top of the implant. everyone is a candidate for implants unless you don't have any teeth missing. Then I would not necessarily recommend it. But yes, there are certainly some medically compromised patients that would be contraindicated for any surgical procedure. If you have severe bone loss in certain areas of the jaw that are difficult to replace that bone and would require a hospital visit where you would actually take maybe part of the hip or bone from elsewhere in the body and replace that into the jawbone. And if you're medically compromised, you're probably not going to be a candidate for that. But otherwise, most everyone would be a good candidate. Well, there's our procedures in which we draw a patient's blood and we spin it down in a centrifuge and we take off the red and white blood cells and we use the platelet-rich growth factors that are left. That's in a gelatinous form, and we can actually use that to place around the implant. We can place it into a socket from an immediately extracted tooth. It speeds up the healing. From what I've experienced, the healing occurs probably at 4 or 5 times faster than it would without this material. And this is all from your body, so it's not, it's called autogenous, meaning it's from your body, so it's not coming from another. It's not synthetic, it's not from some other manufacturer. So it's if you're not using that, and they haven't in years, you can still get results, but it's going to be a much slower process.